When the COVID rates go up, what happens? The hospitalization rate goes up. And the hospitalization rate is increasing dramatically. End of June, we're about 900. We're now at 3,500, okay? Since the end of June. And that is before feeling the effect of the holiday season. We are now worried about overwhelming the hospital system. And if those numbers continue to increase, which we expect they will, you will see serious stress on the hospital system. Today, New York State Department of Health is going to initiate emergency hospital measures. Number one, every hospital has to identify retired nurses and doctors now. We're already experiencing staff shortages. It is mandatory as of today that they balance the load within their system. They balance patient load. So you distribute the patients among your hospitals in your system. The nightmare we went through last time was a hospital would be overwhelmed. But that system had other hospitals that had capacity. If we hit a real hospitalization crisis, we could potentially do a New York pause. California just did a California pause, which is basically a stop, or move one zone to another if we have a critical hospital situation. Thanksgiving, you'll see 3, 4, 5, 7 days until you see people who were infected during Thanksgiving or during Thanksgiving travel. So there'll be a week to 10-day lag before we see that number come to effect. The small gathering spread is now the #1 spreader, about 65% of all cases. This is a dramatic shift. Part of it is the holidays. It's what happens during holidays. Part of it is reduced social options. The COVID GRINCH is an opportunist, and the COVID GRINCH sees this as the season of viral transmission. All those things that the holiday season brings, they all increase social activity, they all increase mobility, and they will all increase viral transmission.